We now move on to an interesting session for which I would like to introduce Dr. Avinash Dal sir, who is a senior consultant, cardiothoracic and vascular surgeon and chairman at TX Hospitals, Hyderabad. With 30 plus years of experience with 9,000 plus major cardiac and vascular surgeries, he is also a pioneer of advanced procedures including off-pump CABG, minimally invasive cardiac surgery, VATS and endovascular repair. Sir is a recipient of national awards for excellence in cardiothoracic surgery. So may I now request Dr. Avinash sir to begin the presentation on role of plant-based nutrition in cardiovascular disease. Please.
Thank you, madam, for the introduction. First, I must thank Pan India for organizing such a nice meeting. And the important part is that nutrition is a very neglected subject right in our medical days when we are students and we are studying. Nutrition is always much neglected, as someone said. Only first year subjects were taught. Something in preventive medicine was taught, social medicine, preventive medicine, we call it. And that was all that was there. And when we came out into practice after this one, and we specialized and super specialized, and we came out, and then we realized that patients' first question when they are going home is what should I eat, or when they come to OP, what should I eat, or the patients are complaining they are not able to eat properly. So basically the nutrition was such an important thing which was neglected. I think it is time that actually government should put at least 6 months of one subject in nutrition in the medical curriculum, because that is a real basic for any specialty. Maybe certain specialties may not require, but most of the specialties, whether you say orthopedics, gynec, GE, gastroenterology, general medicine, surgery, all of them have a focus on nutrition. And that is one thing that now that all of you are here and discussing this thing, it's very important and very good, because we need to actually propagate this into the general public. And I'm also very happy and must thank all the people who have come here to attend this program on a Sunday, which most of people like to sit at home and get up late in the morning in the winter especially, but everyone comes here very enthusiastically to hear this subject, because this is one thing which everyone in a practice, all of our clinical practicing clinicians do face. That is the thing. Whenever you call usually a surgeon or especially a cardiac surgeon for a talk, usually you'll see a lot of pictures with a lot of gory incisions and blood here and there. And today it's not that. Today we are going to focus basically on only our things which are on nutrition, because basically our focus is going to be on prevention. Patients, when they are having this one, when they come to us for surgery, by the time they come to us with cardiovascular disease, for CABG, and to my friends here for stenting and all that, they are already, they're grown up. They don't come at the age of 15, 20. But the disease process starts when they are young, right from their birth and while they grow up. And as they grow up and they slowly mature, the disease process sets in. Also, habits in diet and sedentary life and all the westernization which is influencing us, that all sets in. At that stage, it's sometimes difficult to explain to patient that you must change. And okay, they say, okay, I've undergone surgery, now I must change. Once they do undergo bypass surgery, they are free back to what they want to do. That's not the way. You have to explain to them again. So there is two aspects. One is the primary prevention. Primary prevention is what every physician right from the beginning should be doing. And that one is secondary prevention, that when the patient undergoes procedure or comes with a disease process, and then we try to tell, now you have to do this kind of things to prevent further problems, to prevent it from coming again, because any cardiovascular disease, especially coronary disease, is an ongoing process. It doesn't stop. The body vascular inflammation continues. And our job is to reduce the vascular inflammation, and only giving tablets like statins and ecosprin and all these things are not going to be beneficial in stopping this kind of inflammatory process. We need to actually fight it as a basic lifestyle management. And very important in lifestyle management is diet, that is nutrition, and exercise. That is the thing, and mental health. So these things, then you come to drugs, and before that you come to lab tests and preventive health checkups. So lifestyle management is what we have to focus on, and that is very important thing. As you know, in our history, we have to see that, we are talking about our own Indian thing and subcontinent. So there was a very, Ayurveda was there, and there was Shushruta. Shushruta, a very famous physician from Takshashila University, and actually Sushruta I learned from his teacher, who was Kesiraj Devadas, and he has written the lectures of his teacher, and that has become the Shushruta Samhita. This is 2,500 years back. And in this text, a lot of mentions are occurring on preventive medicine, on dietary changes which should be taken to prevent so-and-so disease, to prevent that disease, and even the division of types of diets, the sattvic diet, which is a very wholesome meal, which Madam has talked about, that you should eat wholesome meals, which is not, which is fresh fruit and fresh fruits and mixed of everything, compared to Rajasic diet. Rajasic diet, we talked about biryani, somebody said about biryani, that is a Rajasic diet, tasty, nice, oily little food and all, and use a real. But other is tamasic diet, which makes you dull and drowsy and doped. So these three types of diets were classified. A lot of work was told about that. This is the time we ourselves had the knowledge. We ourselves have knowledge, and we ourselves have not, because of our westernization and our education is all Western type, we have not focused on this kind of knowledge. Now, of course, government is trying to bring up the research in Ayurveda and all. At this time, when people have written this kind of texts, you should imagine Europe was being invaded by the Vikings and all that, and they were just fighting with each other, and they didn't have any proper concepts. And this is a time when our philosophies were so advanced. And if you notice, we don't honor our own history. We have got this major texts, we don't read them, we don't read the translations. This picture is there of Shushruta, this idol, is in Royal Australian College of Surgeons, by the way. It is not in India. So I took a photo from there. So in Ayurveda, besides the preventive aspects of dietary and all changes, they also mentioned about usage of plants for health. So there are certain plants which are mentioned specifically, like Arjun tree. Arjun, bark of Arjun was very useful for cardiovascular health. And then there is Gugul, which is used for, it has got its own resin type properties, which is to make metabolism proper and indirectly help vascular health. Now all this requires more research. Trifle group, which also is also metabolic rejuvenator, detoxification agent, and that also, we need research, more research into this. And this more research when it comes, then we will be able to use these methodologies and these drugs for treatment or even prevention in candidates. So as we have ancient wisdom, we have an ancient old civilization, even the next door neighbors, China is also got its own ancient civilization, and it's equally ancient as ours. And whether we like them or not, it's different matter, but they are ancient and they are there. And they have their own philosophies, they have their own health techniques, like we have yoga and yogasan, pranayam and breathing, they have their own internal martial arts and Tai Chi, you must have heard of Tai Chi, Bagua, these are internal martial arts which are more health exercises than more of martial arts like Shaolin Kung Fu. So they have their own traditional Chinese medicine, and in that also there are certain things which have come out, like for example, drinking tea or green tea. Basically, tea went there from India, if you know the history. But whatever it is, now they are saying that green tea is good, and they have various types of teas. And ginseng, which is a root which is help in rejuvenation and which helps in detoxification of body. And same way, even in European folk medicine, there are other things like hawthorn, garlic was used there for health purposes. So there is a lot of historical thing which we need to learn from, and we need to look at that. What we have done is modern medicine, we have taken certain things and we try to modify it and use it for treatment, not prevention. For example, you know the famous history of William Withering. He found that one gypsy lady was giving leaves of certain plant for dropsy, which is anasarca because of congestive failure. And then he started giving it, and then that's became the digitalis thing, which was later on purified in 1930. And then the whole digitalis, the whole backbone at one time of congestive heart failure treatment was based on this kind of things. So modern medicine incorporates. It incorporates, like English incorporates words from other languages. Like for example, the word juggernaut is from Jagannath. I didn't know that. It is there in the etymology of the word. So we find that it incorporates. But the amount which it incorporates is basically on treatment. Doctors only treat. That is where we are failing. Now here there are 5 people I have shown you. Of course, Virat Kohli, everyone knows Virat Kohli. I don't need to introduce him. And then Vidyut Jambal is a martial artist, and he's an actor and he's so fit. and the other side you have got Djokovic, who is a famous tennis star, and Lewis Hamilton, and then there is Nike Diaz. Now I put two martial artists in this because I myself very fond of martial arts. I'm a second dan black belt and fourth dan honorary taekwondo black belt. But that is the thing. The thing is, these people, what is peculiarity about this common, what is common in all these people? All these people have become pure vegetarians. They don't eat any non-veg food. They are become pure vegetarians. Maybe Virat Kohli was not vegetarian. He has converted to vegetarianism now, and they are super fit. So the important part of this these are the influencers which are in the society, which people look at, and this is why knowledge of this kind of processes is coming up into the people, into general public, that yes, we need to be fit. We don't need to only eat, because generally the concept is that if you don't eat non-veg, you are weak. That is the concept. You see, I'm not talking about doctors. I'm talking about the general public. There's no non-veg nahi khata, sirf ghas khata hai. He's only grass. And so he will be weak, he's weak. That is not the fact. You have got people who are strong, who are very, who is doing, for example, Lewis Hamilton is a Formula One. When you are going at 200 kilometers per hour, round the bend, your heart rate is more than 40. It remains more than 140 for the whole race. So if you maintain your heart rate 140, I don't know how many people we can maintain heart rate 140 for nearly 20 minutes or 30 minutes of the race and still not get a problem. So that means his cardiovascular health is top. Unless he has that top cardiovascular health, he cannot become the #1 Formula winner. So that is what we are seeing. We have to maintain. This is how we have to hone our systems. So one most important part, as I said, is on diet part. Now we have various types of things, we have various types of problems which we have, and for each we have to, what we need in cardiovascular health, we need to have lower lipids, we need to have a reduced blood pressure. So higher blood pressure causes more wear and tear and atherosclerosis, induces atherosclerosis. We need better endothelial function. We need to reduce vascular inflammation. All atherosclerosis, as we know, is not just deposition of fat. It's once the fat deposits, there is macrophage invasion, and then the atheroma forms nicely and all that, and that becomes a plaque, and then my friend Dr. Narsaraju will put a stent and dilate and clean it out, and then patient becomes all right. But these are all inflammatory changes. And then also the main other thing is also diabetes. Insulin is, weight increases, obesity. Obesity leads also to diabetic manifestations. So we are diabetic capital of the world, India. And this diabetes increases the chance of atherosclerosis and this. And overall, we want to reduce the cardiovascular events. So for this, we have all the means which are there only on plant-based diet. So for example, if you are using more fibers, it will reduce your cholesterol absorption. If you are using other drugs like, for example, beetroot contains a lot of arginine. This beetroot is arginine. Actually, I came to know that when a few years back, when my son is USA, he was doing, but he said, I want to have arginine beetroot gummies. I said, what is beetroot gummies? We went beetroot ka sabji. What? No, that is arginine. So I said, oh my God, this is arginine. They had a look, and yes, it is a lot of arginine is there, which is a vasodilator, which is actually a protector for the heart. And we need other such drugs like polyphenols from fruits, vegetables, and we need to have a reduced glycemic index because of by taking a wholesome diet, as we have discussed, madams have discussed before about wholesome diet and how it reduces the insulin load, the sugar load. The overall effect of many of these regimes on the body, certain things, de-Nornish treatment is there. They have proven that a very rigorous dietary schedule, if it's a balanced diet and a proper dietary schedule with less oil and other things and less harmful things, definitely reverses up to 15% of coronary levels of obstruction. It doesn't get rid of the plaque totally, but it reduces the plaque, and that means it also prevents further plaque formation. So when you have data like that in the literature, we have to use it and we have to tell our patients. Problem comes with patients, they don't listen sometimes. They come back after, first they say they can't eat, so then they want supplements. So we'll give them some supplements. Then when they come back after 1 or 2 months, they say, I want to eat, but my family members are not giving me. So, so we have to give them a proper induction into proper normal, what is good nutrition for them. So if you tell something fancy, you say, oh, you eat quinoa leaves, seeds, or you eat chia or something, all these fancy, they're not going to listen. You have to tell them what is available with them in our geography, in our region, and then treat according to that. So as I've already mentioned, the sources which are available are mentioned here. You see, for example, soluble fiber from oats, barley, beans. Everybody is having beans and all that, apples, etc. Omega-3 fatty acids we already discussed just now. In lot of content is available, and that is actually cardioprotective. So most of the people say omega-3 fatty acids, eat fish. No, you have a lot of vegetarian stuff which you can eat, and you can have the adequate omega-3 fatty acid. You don't need to have something else. And of course, as I said about blood pressure management with all these drugs like spinach and lettuce and celery. As you already mentioned all these things again, that blueberries and berries and dark cocoa. Dark cocoa is actually has got polyphenols, and it has also got certain things which help in reducing Alzheimer's, and also potassium, magnesium, which is in bananas, coconut water and all that. So one thing is that you have to see that one thing doesn't contain everything. You'll have to have a combination, and that is what we need to have, a complete wholesome meal. We can't have one for particular stress on one thing and then leave the rest. So that is what happens, is the problem which occurs. This is again a summary of the situation as to what are the things available here with us and what are their efficacies and their uses. So overall, all these will affect either by controlling the diabetic manifestations, or controlling the level of lipids, or controlling the endothelial dysfunction, or controlling the inflammation, vascular inflammation. Indirectly, the overall vascular tree will improve or remain at least at that same level, and it will prevent further degeneration and senescence. What happens when senescence occurs of the vascular tree? It will form blocks. That blocks will affect either cardiogenically heart disease, or it will affect even brain, or affect any other organs. And hypertension will definitely cause other side effects, including renal and other things. So the one thing will affect everything, like any system. All systems are interrelated. So cardiac system, cardiovascular system, once it degenerates, it will affect all the remaining systems, and that will lead to early mortality. And we know that a lot of things we have studied about early mortality and due to manifestation of eating the wrong diet, which you studied in the previous papers. Sure. Just 2 minutes. Well, there are certain compounds which are there, which are found in this one. Lycopene is found, which is helps vascular health. Rivasterol, I leave it. Coenzyme Q is one of my favorites, because actually coenzyme Q, I read a lot of papers about it, and then I started using in my practice. So coenzyme Q is produced outside. There are natural compounds available for CoQ. CoQ is a mitochondrial tonic. It doesn't affect our cells, it affects the cell in the cell. Mitochondria are actually cells which have developed within our cells. There is a theory that they are not actually part of our system, they have their own DNA. So this is a mitochondrial tonic. So previously it was to make from the chitin of crabs, that is not plant. But nowadays from tobacco leaf, they are able to make coenzyme Q extract in the factory. So cost has come down to 10 times less than what it was before. And so, see, tobacco people misuse and cause cardiovascular problem. If we extract the coenzyme Q, it is good. So tobacco is tobacco, but we are using it differently. Product we are using better, the original we are using bad. So both are not same. Well, we already think if there are certain things one has to limit naturally. These are the ghee and other things, excess salt, which causes increased hypertension, and also a lot of non-veg diet and a lot of paneer and all that. People use a lot of cheese, cottage cheese and all that, which contains a lot of other fats, and whole milk and other things. So these are things which one has to avoid. But then there are ovo-lacto-vegetarians, or my son calls it flexitarians, who fluctuate. So sometimes we have to tailor the diet to that. Before I stop, there's only one thing, that excess of any one thing is dangerous. So if you are going to say, I'm taking plant-based diet, but I'm going to take only one type of plant-based diet, I'm not going to mix up all the remaining things. For example, I'm not going to take brown rice, I'm going to take only or other cereals, I'm going to take only processed cereal, but at the same time I'm taking only plant-based diet. That excess of things is problematic. Some people think I'll take excess of fiber. That excess fiber causes a problem, because if he's eating only fiber, he's going to lose his nutrients. And sometimes isabgol powders and all which you get in the market, they even cause constipation. Sometimes they cause diarrhea. So all these things are not, it has to be balanced. Everything has to have a little bit of common sense put inside, and then you have to coordinate and make a wholesome thing. Same thing, excess sugary fruits are there. You'll put on weight, and even the diabetic chart may go up and down. And that's the thing. So we have a lot of excesses in sometimes in dietary manifestations which we have to balance. Main thing is balance it, make a wholesome meal out of it. Superfoods is a thing which is there now. Superfoods are good because superfoods are available in market and they are good, but the problem is that they are not for all the Indian population. You see, our Indian population, many of it is below poverty line, and some of them are lower middle class, so they may not be able to afford all these superfoods. But some superfoods, they are very good. They've got high nutrition, they've got a lot of fiber, they have a lot of minerals, vitamins. They are available in the market. They are available in this one. I'm not going to say anything more than that. And commonly, it is berries, lot of greens, lot of nuts, whole grains, green tea. All these are superfoods which are available to us. And these are not all that, whole grains is not costly at all. You see, I don't know how many of you are from Kerala, but if you go to Kerala, they don't eat white rice, they eat brown rice. And it's so nice. Okay, I like brown rice actually. I was staying in Kerala for so many years. So same thing, we have to see all these risks and limitations of this. The risk and limitation of superfoods, sometimes it's a fad. Like quinoa was a fad in between. Everyone was buying quinoa at some 600 rupees a kilo and whatnot. So all these kind of fads we have to avoid. We have to be common sense. We have to use. See that our diet is completely normal and this one. So basically, plants have given us a lot. They are actually our silent protectors. Plants say, I'm very happy that you honored plant here on the stage, and that is very good. Plants are actually giving us the oxygen. Oxygen, the word oxygen means the giver of life. So same way plants are the giver of life for us, and they are giving us everything we need. So we don't need to do anything else. And even if you are cutting plants, they don't even cry back. So it is so nice, and they are really like a motherly care they're giving to us, and we should appreciate that. And we should try to inculcate a more plant-based diet, especially concerning our heart and vessels. Thank you. Sorry, I took time.
Thank you so much, sir, for that practical and clinically relevant talk. So we now have a Q&A session. So I invite all the speakers, Anusha ma'am, Pallavi ma'am, and Avinash sir is there. So we'll quickly take a few questions from the delegates.
Any questions from audience?
Hello, I am.
Mic will be given, ma'am. Just a second, sir.
I am Dr. Jayasundar. My question is, there are many types of olive oils in the market, like pomades, extra virgin, pure, like that. There are many, but they are very expensive. What about the middle class people? Which oil is better for their cardiovascular health?
Thank you, sir. Sir, actually the main important part is that trying to go after the exotic oils, canola, olive oil and all that is not actually necessary. Most important thing is that the oil content should be less, and combination oil, mufa and pufa, especially like even like groundnut oil is okay. Some people say rice bran oil, but I'm not very convinced about it because the gamma oryzanol in rice, which is the actual element which reduces the problems of vascular problem, gets destroyed. It cannot be preserved in the oil. But that's the thing. The rice bran has got, if you have gamma oryzanol, you can produce outside, that will be, but in oil it doesn't remain. So as it's any oil, but in a very lower quantities, and that's only what is important. Going after these fancy oils is not required, sir. Thing is that cooks want to do it fast, so they put more oil. That's the problem.
Sir, I recommend people to use 3 different kinds of oil based on their cooking. So if you're going for deep fries or anything, use the refined oil, because that's the only stable form of oil that is available for us. So when we use cold pressed or any kinds of oils, that for deep fries, it loses its nature and it gets oxygenated. So we should not be using glycated end product causing oils. So the main target here is whichever type of cooking. You're doing a deep fry cooking, use refined oil, or you're doing just the normal cooking, low flame, or you're doing saute, you can use any kind of oils. For us, South Indians, it is coconut oil, sesame oil that are available. For North, if coconut and sesame are not available, they use mustard oil, which is more common, so they can use mustard oils. And we can use pure ghee also, sir. Ghee is also a best form. So these oils should be altered. They should be, and it is available for everybody. They're not costly.
My question to Anusha ma'am, what you are telling about the fermented vegetables, means what
Yes.
exactly?
Ma'am, it's nothing. It's like kimchi and all that which they are propagating now. But in olden times, we used to do mango pickles, lemon pickles, and that is fermented vegetables. For preserving the vegetables which are seasonal. So based on the season, we used to get the vegetables as per the season. But now we get all vegetables in all seasons because of hybridization, because of the genetically modified foods and all. But because of that, it has all altered. But actually, fermented vegetables are nothing but pickles. The only problem with pickles is we use high salt content for preserving it, right? So everything in moderation is not harmful. Eating it on a daily basis will cause problems. Now we don't need to even ferment vegetables because we're getting all kinds of.
So I would like to add one more thing to this. Fermentation the point is fermentation. Vegetables you can eat anywhere, but why fermented vegetables is because of the fermentation. So we get a lot of other fermentation products too. One point I would like to make is like sir was pointing out ancient wisdom. We all in villages, we used to ferment, kanji, the basic thing, kanji, overnight fermentation. And we lost it. Now it is coming out to it is being sold now as a delicacy, okay? Even in outside countries, okay? But then we lost that art. Just simple. This is the most simplest thing we all can inculcate immediately. In fact, I came to know of a practice in the villages where they actually ferment the kanji and leftover rice over 1 month. And it was given some religious significance, and everybody in the family used to take it once in a month, like medicine, they say. Extremely good. I didn't know such a thing existed, and the science behind us is this. So, yeah.
Madam, in Kerala, there is kanji vellam, which is everybody has kanji vellam. Especially when somebody is sick, they give that thing, and it's available anywhere. So kanji vellam is actually a routine part of Kerala diet. Actually, Kerala diet is very, very wholesome. That they don't use much of oil, much of cooking and all that. It's very wholesome and nice diet actually. So nowadays one more fad is about kombucha, fermented tea. What do you think about it?
Oh, no, that's good too. That's good too. In small amounts, moderation. The point is key is the fermentation. We want the probiotic effect. I do not want the sugar there. But so it's the fermentation that is important, not the.
Thank you, ma'am. We'll quickly take one more question.
Sir, you have talked about excess raw.
Hello, I am Dr. Sudhakar. Somebody asked fermented vegetables. Sauerkraut is a nice fermented vegetable, that is our cabbage. It is available in Amazon. And regarding other things, using refined oils, I am totally against it. And madam, can you tell us any oil which we use in India has less than 30:1 of omega-6, omega-3? None. Only groundnut oil comes nearby with 39:1, maybe after the rice oil. Even sesame seed oil, it is more than 100. And second thing is, if I have to advise, I will advise only ghee, butter, coconut oil. And occasionally you can use seed oils. Because seed oils cause, number one, cause inflammation, which is, everybody knows, is a major cause of other diseases. Thank you.
Due to time constraints, we'll just take one last question, sir.
Sir, you have talked about eating excess raw vegetables can lead to absorption of medications.
Yeah, because see, all these raw vegetables, they've got binders, they've got ligands, which will actually sometimes your medications can get altered. So that's something that is correct. And also, too much of eating may even raw vegetables, especially sometimes raw fruits and all, can cause a little bit of loose motion and all that, which again causes a problem in the this one. Or sometimes some patients on the other end will get constipation. And that constipation will be very hard stool, which even requires, sometimes I've seen requiring a manual removal also. That's bad. So those things will actually undergo necrobiolysis in the gut and form more dangerous products actually. So that's why it has to be moderation.
Moderation.
Excess में तो कुछ nothing.
And other thing is about the beets, nitric oxide. That is the pillar for the discovery of
arginine is one of the actually helps in the production in the
Verisic what was has come up the new drug for chronic heart failure. Which works on the cyclic GMP, which improves the...
Yeah, so actually the arginine is one of the things which helps in the production, nitric oxide production, and that's actually one of the very important things which, that I agree with you. Sir.
And the other thing is, beets are kept in...
This will be the last question, please, and any other questions, we can always discuss it over lunch. Thank you.
Sir, is there anything like recommended omega-3, omega-6 ratio of intake? And the second thing is like, I have gone through some CME, some table, there is a nutrition database of USDA. In it, sunflower, safflower, even sesame, they told like omega-6 is there and omega-3 is 0 literally. And there are something like sunflower, safflower, all this, there is no omega-3. There are some list given like canola and something like fish, flaxseed. And flaxseed literally getting almost 50. Very high omega-3 compared to omega-6, and fish is completely omega-6 0 and omega-3 is 100%. They have given data. So is there any, and one more thing is like, is omega-3 is okay to take, or it is completely like anti-inflammatory, like pro-inflammatory, or it is also required for body somewhat? It is my doubt. And the ratio, how much we have to take is like.
So both omega-6 and omega-3 are required for a body for maintaining cell membrane integrity. So omega-3, because there is increased intake of omega-6 and omega-9 fatty acids, they have now propagated on omega-3. But anything in moderation, and like Hemalata ma'am had portrayed, the omega-6 is to omega-3 ratio is to be around 4:1 or 3:1. But now it's around 30:1. So that's why they're propagating omega-3, but that doesn't mean that you have to not eat this, not eat that, but you have to maintain the ratio. That's what it means. Different kinds of foods give different, this thing, like you said, plant-based flax seeds, all these are rich in omega-3. Olive oil and fish is rich in omega-3. But not all fishes are again rich in omega-3. So there's a lot of difference. So there's a lot you have to go into the nutrition part to understand it. And so it's always better to have moderation.
Thank you so much. Thank you, sir. So now I would request Pallavi ma'am to felicitate Avinash sir and Anusha ma'am. Thank you, ma'am. Now we have the most awaited session, panel discussion on obesity across age groups. For that, I would like to introduce the moderator for this session, Dr. Amreeta Yanamandra ma'am. Dr. Amreeta Yanamandra ma'am, who's a senior anesthesiologist and certified lifestyle medicine consultant and health coach, who's also chairperson Pan India Hyderabad City Chapter. She's also a certified CBT practitioner. So I now invite Dr. Amreeta ma'am to initiate the panel discussion.
Hello everyone, and welcome to this session on panel discussion. The theme of the panel discussion is obesity across all age groups, nutritional perspective. We're very fortunate to have a diverse group of doctors here with us today as panelists for this session. and want to thank each one of them for taking their time out from their busy schedules to be here to educate us and inspire us. So the format of the panel discussion will be, I have some questions for the panelists, and we'll discuss that for about 40 minutes or so. And then at the end, we'll have about 15 to 20 minutes of question and answers from the audience. So if you have any questions, you can write it down on your notepads and then ask at the end of the session. So why have we chosen this topic on obesity? The global prevalence of obesity has significantly increased in the past decade, so much so that the WHO has declared this as a global epidemic. And as per the National Family Health Survey, that is in India, about 24% of Indians are overweight or obese. That's a huge number. That's 1 in 4 is overweight or obese. And what we commonly use, the BMI that we commonly use as a metric for measuring obesity, the Asian Indian phenotype is particular in a way that they develop the metabolic issues or the metabolic problems much earlier or at a much less BMI than the Western population, just like Dr. Hemlata ma'am told in her talk. Now, those who are overweight and obese, we know what problems they have: cardiovascular problems, diabetes, cancer. There are about 13 different types of cancer which are caused by obesity or which have an association with obesity. And the WHO has said that by 2030, almost 3/4 of men and 2/3 of women will be overweight. And that's a very serious health issue. So let's dive into seeing what actually drives the obesity in India and what we can do about it. So for that, I would like to invite our panelists. Dr. Narsaraju Kavalipatti. He's a senior consultant cardiologist and a director at Care Hospitals, Banjara Hills. And he has vast experience in cardiac care, especially the complex coronary interventions. And he's known for his leadership in clinical research and has been the principal investigator in a lot of cardiac trials. Dr. Narsaraju, please come to the dais. We have a senior consultant obstetrician and urogynecologist, Dr. Vinatha Puli, who's a consultant in Cloud9 Hospital. And she has about 20 years of experience, has also worked in the UK, and her expertise is in high-risk pregnancies and also laparoscopic surgery and urogynecology. Dr. Akhila has a unique combination of medicine and data science, and she's the founder and CEO of SEDS, did I pronounce it right? Oxidius Health Technologies, and she's the General Secretary of Telemedicine Telangana State Chapter. We have Dr. Chandrasekhar, who's a senior pediatrician and professor in Malla Reddy Medical College. He's had vast experience in pediatrics, neonatology, and pediatric cardiology, and has been trained in the USA, worked mainly in the tertiary care congenital cardiac center. And he was also associated with the Indian government. He was deputed to set up the departments in Maldives. We have we have Ms. Supraja, who is a nutritionist and health coach. She's a founder of Own Your Health, and she's a certified plant-based nutrition from eCornell, also holds an MBA, and she is one of the BODs of Hyderabad City Chapter.
Eat for two. And even if the pregnant woman doesn't think it, there's always an aunt or a friendly neighbor who believes that. We have to question the norm that the pregnant women, or in pregnancy, the pregnant woman has to eat a lot. So I would like to ask Dr. Vinatha, what are some of the maternal complications associated with obesity in pregnancy, and what sort of advice do you give to ensure that the woman maintains a decent gestational weight?
Thank you.
I think you started very well saying that pregnant women has this challenge, not for themselves, but for all from family, that they have to eat for two. So we see, as it's a global epidemic, we are now seeing lot of pregnant women who are already obese. So what complications, you name a complication of pregnancy and obesity is a risk factor for it. So early pregnancy, we are seeing more miscarriages for those women who are obese, and the DVT, the problems with clots in the legs, especially when they have vomiting in early pregnancy, they are at even higher risk when they are actually having obesity. So we have to make sure that they are not developing with rest also. As how diet, everything, pregnant women are asked to rest during pregnancy. I think that is some cultural thing that we have to come out of it. And so DVT and pulmonary embolisms, these are very common in early pregnancy compared to other population who are not obese. And middle of pregnancy also, they are more likely to develop diabetes, high blood pressure, everything quite early on compared to others. So they are having more complications associated with the same problem that they develop later because of just pregnancy. If obesity is added to pregnancy, they are at very high risk. And later on, placenta separating before deliveries, problems coming with high blood pressure and everything. And during labor also, their potential for normal delivery is reducing. And the complications associated with the same cesarean is higher. Like compared to anesthetic complications, the handling problems, they are all getting higher during wound infections, how much ever like a care. And so the use of antibiotics are also getting more for these women, which we wanted to avoid. All these things are specifically to obesity and pregnancy.
And what are some of the risk factors that you can identify? So risk factors for children who will be born to the obese mothers that you can identify in the antenatal period.
So risk factors in children,
So for the risk factors that antenatal risk factors, which will
that
then
be leading to higher BMIs in children. First thing is how maternal obesity itself is one of the risk factor. So if woman starts pregnancy with a higher weight, then that itself is a risk factor. And the way she gains weight, some people will start off nicely, perfect BMI to start the pregnancy. But during pregnancy, they just gain very rapidly, 20-30 kilos or even more. So that is one of the factor. Development of diabetes in pregnancy is one of the factor. And even stress levels of mother. Nowadays we are seeing pregnant women are more stressed at work, at home, with everything. So that increases cortisol, and that can have influence on BMI trajectories of babies. And even smoking has become more common in pregnant women, in general in women. So in pregnancy also they are unable to stop. So that also increases the stress, the smoking habits, the diabetes, rapidity of the weight gain. They all have potential for the fetal programming that can influence BMI in the babies.
So if we educate the mother that, whatever problems, if she has any problems, that can lead to their. Can you hear me now? Yeah. So essentially educating the mother that, the obesity or the high weight gain during pregnancy can obviously affect the baby and, can then further lead to obesity in the child. And that awareness we have to create for the patients as well. So citing National Family Health Survey data, UNICEF has said very recently that by 2030, it is projected that in India, there will be more than 27 million children and adolescents from the age of 5 to 19 who will be living with obesity. And that will contribute to about 11% of the total global burden. And that is a very, very, very high and scary figure. And that puts looking after children and their health and managing or preventing obesity extremely important. So I would like to ask Dr. Chandrasekhar, what are some of the risk factors for childhood obesity? And so starting from birth, infancy, and later in life. And is there a relationship between infant feeding and, bottle feeding and breastfeeding in terms of obesity?
Yeah, it's a very good question. India is swelling up like anything. Yesterday I was attending a American Medical Association with a CME conducted in AIG. He has shown a world map where the India is swelling up like anything, especially the childhood obesity, what Amrita has talked about. By 2030, we are going to cross 27 million children living in India with obesity. When I was a postgraduate in All India Institute of Medical Sciences, Delhi, we don't see any, way back in early 1990, we don't see any obesity in children. We saw only malnutrition. Now it has turned into a malnutrition. Going into malls and eating lot of ultra-processed foods and hydrogenated fats, deep fries. Children are overburdened with their weight. And already we have crossed the population of China. We are going to cross this figure also. Maybe I am suspecting 30 million you can see by the end of 2030, which is a silent pandemic, which we need to talk about it and which we need to address also. When we talk about the obesity in children, there are 4 phases. Neonatal period, because the seeds are sown in the mother's womb. The next comes the infancy, then the childhood and adolescence. If it is in the neonatal period or in the mother's womb, the kind of food they eat and maternal complication, already doctor has talked about it. Infant born to the diabetic mothers, IDMs especially, and IUGR babies, intrauterine growth retarded babies are small for gestational babies, they're bound to have obesity, and most of them, they turn into 80% of the children born with these kind of problems, they turn into adulthood obesity. So we need to be very careful whatever is being sown in utero, because the nutrition starts in the womb to tomb. So we have to be very careful, otherwise all these things are increased risk factors for cardiovascular disease at a later date. And the other thing is infant feeding. Breast milk is for the baby. Cow's milk is for the calf. It is not for any. We drink lot of milk is the best source of calcium, they say, and they drink like a hell, and they make most of the babies obese because of bottle feeding and formula milk. So we need to. And other thing is, first 6 months of life, exclusive breastfeeding, followed by complementary breastfeeding to be continued till 2 years of life. But what is happening is, they continue to feed, they stop milk till 2 years or sometimes even 5 years, they are sowing seeds. It is dyslipidemias. Dyslipidemias, obesity. Obesity is nothing but a chronic inflammation ongoing in the body. We need to arrest it, otherwise the future generations are going to be having all these lifestyle diseases, NCDs. The third thing is adolescents. Why adolescents are becoming most obese? Because they're not moving at all. They don't have any knowledge about the illiteracy of nutrition. Right now they are concentrating on the nutrition. We have a nutrition. If you are literate about your own nutrition, nobody becomes obese unless it is a genetic cause. So we need to talk about it, and we need to have a nutritional literacy, education, and one need to know about what are the complications of obesity in the early childhood. They can understand. And they are sticking to the screens. They are spending a lot of time on the screens. Physical inactivity. One need to move as frequently as they can. Earlier, most of the children, they move a lot. Now nobody is moving. They're sticking to the chairs. They can't even get up from the chairs. And all these things are causing a lot of problems. Other things, and they eat lot of ultra-processed foods, especially energy drinks, sugar-rated beverages, lot of fried stuff with lot of salt and hydrogenated fats. All these are causing a lot of burden in the children. Ultimately, they don't eat fiber at all. We need to stress on the fiber because fiber is very essential.
So essentially, yes, mall, I think that is a very good, I've heard it for the first time, but yeah, that's what is actually happening nowadays, that the children are eating a lot of processed food, a lot of sodas and fizzy drinks, juices, and there is very little physical activity. So it's all compounding to increase weight gain. Similar problem we have obviously across all age groups. Emerging adulthood starting from say 18 to until they're 25, that's kind of a distinct kind of developmental phase where young adults are exploring, they're moving, maybe they're moving out of the house, they're moving for work to another city. And I would like to ask Dr. Akhila, what sort of risk factors are there in this typical age group? And what sort of dietary advice can we give the young adults to maintain a decent body weight?
We have all distinguished doctors here, so I don't think I'll need to talk about the textbook defined risk factors. But I'll try to focus on the data, what the data speaks about it, and what we are seeing, the kind of trends that we are able to derive from it. I think until the age of 16 to 18 years, they are under the surveillance and supervision of parents, and pediatricians play a very crucial role here in guiding them on a certain lifestyle habits and everything. But from the age of 18 to 30, specifically the structure of the movement and the functionality of the body, whatever happens, is changing drastically. In the schools and colleges, we have physical activities as a part of the curriculum embedded. There is time that is specifically given for those activities and the movements. And then that is completely getting lost in this period of 18 to 30 years specifically, or 35 years. This is the time when major transition is happening to sedentary lifestyle, which is a biggest risk factor that we are seeing today. And not just that, the entire circadian rhythm is getting affected, because most of the jobs today are desk jobs, sedentary placement for around 6 to 8 hours. Work from home has even added to the burden, I believe. There is no movement during this entire time, and there is also disturbance of the exposure that needs to happen. So whatever time that they get to spend is during the weekends or during the night time, and that's where binge eating happens. That's again, faltering our entire system. So what's happening here is, I don't say that this particular age group is not aware or sincere about tending to their healthcare needs. They are, but what are they relying upon? One of the doctor has shown great pictures of influencers who practice while they preach as well, like Virat Kohli. They have a nutritionist available to them, and then they are able to implement those particular lifestyles. Who are the other population looking upon? So what they are seeing in the social media, trends, media, everywhere, is the availability, overload of misinformation, and that's where they are relying upon. It's not that they are not looking for a change, they are looking everywhere, they are looking for accessibility, but what is accessible in a very quick and convenient manner is the wrong choice. That is leading to the disturbance in the entire structure. What happens during the first 30 years is actually defining how your life is going to be in the next 30 years, right? And this is where the entire corruption is happening. I think this is the time period where more focus is needed, more awareness is needed. I loved the presentation given by Hemalata madam. It was overloaded with valuable information. This information, this evidence needs to be percolated down. It has to be available and accessible everywhere. doctors here today might not be having a lot of time to educate and create awareness on that. That's where we will need, technology probably coming into the play and then trying to aid in that scenario.
And that's your specialty, and I'm going to ask you a question later about that. Moving on to elderly patients, I would like to ask Dr. Narsaraju, what are some of the cardiovascular health impacts of obesity in elderly patients, and does nutrition play a role in managing these patients?
Yeah, elderly patients with obesity, or for that matter, anybody with obesity, has some cardiovascular impact happening on them, especially with hypertension. So one impact that could develop with obesity is hypertension. Again, hypertension can develop by obesity per se, or obesity-related obstructive sleep apnea can lead to hypertension. Then obesity promotes type 2 diabetes, insulin resistance, which is implicated with cardiovascular risk. Then dyslipidemia, obesity-related dyslipidemia. Then obesity can also lead to, heart failure. Per se, obesity can lead to heart failure even with a preserved ejection fraction. With normal ejection fraction, patients can develop obesity-related heart failure. Then variety of atrial arrhythmias. All these arrhythmias can lead to implications like stroke and all that. Again, obesity can lead to non-alcoholic liver disease, NAFLD, that can also have implications on the cardiovascular health. So multiple ways obesity can lead to cardiovascular disease. And of course, the three main principles of obesity management. One is the diet, second exercise, and medications. Among these, diet plays a definite role. A diet which is less in calories and less in saturated fat, as we heard the talks from Dr. Avinash Dal, less of saturated fat and more of unsaturated fat, polyunsaturated fat, predominantly omega-3 based diet. Then there was a discussion on the ratio. The ideal ratio is 1:1 or 4:1. So that's the N6 to N3, omega-3 to omega-6 to omega-3, that is the ideal ratio. And that definitely helps in reducing the obesity-related inflammation. See, obesity is also known that in obese people there is an increased inflammatory markers. So the adipocytes release the cytokines, and these cytokines can lead to inflammation. Arterial inflammation, is one of the important factors for development of acute coronary syndromes. So an underlying plaque gets disrupted or develops a thrombosis because of inflammation happening. So the markers, the inflammatory markers, typically the CRP and the cytokines, if you check these obese individuals, they have elevated levels of this. So the obesity-related inflammation leads to acute events, and obesity per se, with the development of all the classical cardiovascular risk factors, can develop atherosclerosis. That's the link between obesity and cardiovascular risk.
So, nowadays we know that almost every disease is caused by chronic inflammation in the body, and that is a very important factor. And obviously unhealthy diets and other lifestyle modifiable risk factors are all implicated in the inflammation that we all see very commonly nowadays. Nothing can be more frustrating than knowing that as you're aging, the aging process itself is causing your midline to bulge, having the midlife bulge as it is called. So I would like to ask Dr. Vinatha, and especially in women, I would like to ask Dr. Vinatha, who's a gynecologist, is there a relationship between sort of hormones and the midlife bulge? Is it sort of, despite the fact that we may be following a healthy lifestyle, that we see this very commonly? And what sort of advice do you give women?
It is real, yes. Menopause increases the risk of us who were healthy before to, have more visceral fat. But that is also associated with that change in the life time, that there will be less muscle mass. that is associated with hormone changes. No hormone is going to, get our muscle mass to be less and more visceral fat deposition. So if you ask me why we are staying healthy, we are eating good food and we are doing exercise, still we are gaining weight. That, yes, it happens in menopause, but HRT is not the answer for it. I think we have to, because of this reduced muscle mass, the capacity to use our calories are also getting less. So I think we have to advise them, we have to little reduce whatever the food that they are eating, a portion size has to be reduced a little more, and also exercise has to be increased a little more. So what we were doing for our routine life before that midlife and after, we should just make these subtle changes so we can maintain that well. But embracing that changes, I think that will improve our emotional quotient, and that might also reduce our stress levels, and thereby, the way we manage that weight gain might be a little better, and hopefully that should solve that issue.
One important point, sorry to interrupt, since Madam raised the issue of muscle mass and visceral fat. See, the way of looking at obesity should change. We always look at obesity in terms of BMI, which is not the correct way of looking at it. The reason is, suppose you have a very highly muscular man, like say for example Salman Khan. If you look at his BMI, it would be very high because he has got a lot of muscle and bone. So it is, in fact, he has no cardiovascular risk because of this BMI. So don't look at always obesity in terms of BMI. Look at the waist circumference, which is a surrogate marker for visceral fat. Visceral fat is what we are concerned about because the visceral adipocytes are the ones which are involved in the cytokine production, the increased lipolysis, increased free fatty acid production. All that is happening from the visceral fat. So the best way for Indians is look at the waist circumference. In men, it is more than 78 centimeters. The typical way to measure the waist circumference is between the rib cage, the lower end of the rib cage, to the upper end of the groin, that point at the level of the iliac crest, say, third block. It is the iliac crest to the lower rib cage. If you have the midpoint, you measure it in a normal exhalation. You measure the circumference, and if it is more than 78 in a male or more than 72 centimeter in a female, you have the danger bell ringing. Sorry to interrupt you.
Can I add something to that?
Yes.
Yeah. Not only that, sleep also plays a very important role in the obesity. The disturbance in the circadian rhythm is one of the biggest culprit. Most of them can't sleep even for 5 hours a day. You become obese when your sleep is very less. That goes into a vicious circle where you can have any disease on earth. After some time, what is needed especially is hydration, sleep, exercise. These three are one of the most, and nutrition. These four are the pillars. And there is a lot of debate going on about how do you classify this obesity. BMI is no way. It is already out. People are talking about waist-hip ratio and waist circumference and the height. There are so many ratios are coming up. There is a body roundedness index, BRI. There is a lot of debate is going on. I don't know. World Obesity Forum is going to come out with a proper guidelines where you can quantify the obesity, where you can guidelines can be produced where you can do it in a right way. So at the moment there is a lot of confusion. Like Sarah already pointed out, a muscular man having a large BMI doesn't mean that he is obese.